Hello, my name is Rudy Sinharay and I am a respiratory physician at Welbeck. Today I'm going to be talking about lung cancer. So what is lung cancer? Lung cancer is a disease of the lung where a collection of abnormal cells grows over time and eventually cause some lumps and bumps, turning into a tumour. Lung cancer is one of the most common cancers and it's the third most common cause of cancer deaths in the UK. There are around 49,000 cases every year of lung cancer. Symptoms of lung cancer include persistent cough, coughing up of blood, breathlessness, unexplained weight loss and fatigue. The biggest risk factor for lung cancer, of course, is smoking, but there can be other risk factors associated with lung cancer, such as being of an older age, air pollution, background radiation, and of course a family history as well. So what should you do if you have symptoms that you think may be related to a diagnosis of lung cancer? At Welbeck, we are offering a lung cancer screening program. You'll be invited to have a lung function test, which takes around an hour, and a CT scan, which doesn't take more than 10 to 15 minutes. This will be able to tell us about your lung health, and also the CT scan will be able to detect whether you have any lumps or bumps in the lung that may be concerning for an early diagnosis of lung cancer. Lung cancer screening is important, particularly for patients who are at risk of developing lung cancer, such as smokers or ex-smokers, because the earlier lung cancer is diagnosed, the better outcomes there are for patients. What are the risks associated with lung cancer screening? Lung cancer screening is a very safe and straightforward assessment. Lung function testing has very few risks associated with it. Some people can get a little bit dizzy sometimes if they've been blown quite hard into the machine. CT scans use ionizing radiation or X-rays, and there's a small risk associated with this. We do use the most advanced CT scanners, which use low-dose CT scans, which minimize this risk significantly. Following your lung cancer screening assessment, you can go home and get on with your usual activities. If there are any suspicious abnormalities found on your CT scan, we will let you know the same day. Occasionally, a CT scan of your thorax can find something called a lung nodule. A lung nodule is a little spot or freckle in the lung, and these are what we describe as indeterminate lesions. 95% of the time, these are benign and do not cause you any problems. However, in 5% of cases, these can turn out to be early lung cancers. If we do find a lung nodule that requires further follow-up, you will be invited to have further surveillance CT imaging of your chest, and we will discuss this with you. If you'd like to find out more about lung cancer screening, please visit the Welbeck website and a clinician will be in touch with you.